This is Dr. Tapaswi Krishna, consultant pulmonologist at Gleneagles Global Hospitals, Lakdi Kapul. We are here today to discuss the various variants of COVID and the present variant which is creating more number of cases right now. As of January 5th and 6th, we have seen a sudden burst of increase in the number of corona cases, especially the upper respiratory variant rather than the lower respiratory. How do we understand this? How do we take it further? Like all of you already know, we have had what we call as Delta virus in the second wave, whereas in the third wave that has almost taken up from Jan 4th and 5th, we are seeing some amount of Omicron virus which is actually started in South Africa and some number of Delta virus in some patients. So Omicron and Delta are going hand in hand right now. We are almost getting 50% Omicron and 50% Delta. The only difference being Delta during the last wave was causing lot of hospitalizations. But now, because the patients are already vaccinated with double dose and some people with booster dose, there is not much of lung involvement in this wave. So patients coming with low oxygen, breathlessness, and these things are less now. Whereas with Omicron, patient is having an upper respiratory symptoms and then they are going home happily with home isolation. But all this said, there is a new variant which is coming out which is called Deltacron, that is cross between the Delta and Omicron. We don't know how it will react with our demographic. South Africa, well and good, they have recovered, they didn't have many ICU admissions. It is the same right now in Telangana, Hyderabad and our hospital. We don't have many ICU admissions unless the patient is very immunocompromised, that is post-transplant or post-operative patient. Unless they have COVID, patients are getting discharged and going home or taking OPD basis treatment and they're going home. So there's no problem there. But still, we definitely have to pull up the vaccination drive, take the boosters. People who are unvaccinated, especially the under 18 age group, we'll have to target that age group, make sure they get their vaccines before they go back to the schools. Because we don't know what are the long-term effects. Nobody has studied this virus before 2 years. 2 years is a very small time frame to understand what are the long-term effects of the virus. It is not that we say, okay, fine, the patient gets affected once, twice, thrice, it's okay. We never know if it's okay. So prevention is always better than cure. We definitely have to continue our hand hygiene, face mask and 6 feet social distance, so that the number of patients who are getting affected keeps coming down and slowly the virus will leave the pool. So that should be the target, and continue to keep ourselves vaccinated. Apart from this, we need to have a healthy diet, keep all the comorbidities like diabetes, hypertension, hypothyroidism and obesity under control, because people who have the comorbidities are the ones who are getting worse affected. And one odd patient who is having desaturation, that is oxygen levels going down, is if they have very bad uncontrolled diabetes, hypertension or obesity. So these are the things we have to keep in mind. We have to go for regular exercise with mask. So if you're going for a morning walk, it doesn't mean that because we are going for morning walks we can avoid a mask. At least a cloth mask, which will probably be more comfortable for you all than a surgical mask, is good if you're going for a morning walk. Take a high protein diet with eggs, pulses and white meat rather than red meat. That would improve and boost your immunity. Dry fruits and fruits in the first half of the day would help you boost your immunity, because diabetics and hypertensives, fruits and other food in the second half of the day would add to the sugars. So you should take it in the first half of the day. Keep your immunizations up to date. Please avoid social gatherings, because invariably you tend to take off your mask and talk to the other person and come down on the social distance. So avoiding social gatherings will make a big difference in us coming out of this wave as soon as possible. The deal and our goal should be, we should be able to come out of this wave unscathed. So even though people are getting affected, we should make sure more people are not affected. Isolate yourself earlier. In case you know you have one symptom, that is running nose or cough, please report to your doctor. Don't try to go to work and think that they won't grant me leave. Please identify your symptoms and please go ahead and get yourself tested. Now it's not a big deal having COVID, so please don't feel any stigma. It can be treated within 5 to 10 days. So we all have to get on and get out of this as soon as possible. Coming to asymptomatic patients. Now rarely people are hardly traveling now, but whoever is traveling, when they do an RT-PCR or when they come back from their travel, when they are doing an RT-PCR, they are talking about what we call as asymptomatic positives. But these people, if we trace out when they come to us, they have had one odd symptom 5 or 6 days before. That is fever or mild cough or some headache or nose block. So there's hardly much of asymptomatic positives right now. When they come to us, they tend to give their history that they have had that one symptom. So that's why I keep insisting that any symptom, please test yourself, isolate, so that rest of your family is not going to be affected. Isolation is the key to get out of this.